Now, our final speaker today is going to be John Boffa, who we're going to bring up to the stage in a moment. John is a bit of a GP icon in the Territory and really is what we should all aspire to being, especially the registrars, which is advocates for our community. John's going to talk to us today about social determinants of health, and he's had some great success into getting politicians particularly thinking in different ways about this, especially in Central Australia. And that was rewarded by him being nominated as Australian of the Year in 2012, which we're very pleased to see. He's been in the Territory 25 years, is that right? Yeah, so has a wealth of knowledge to share, and we're going to ask him to speak as quickly as possible so he can share as much as that in the next.
All right, so what I was going to go through, I'll quickly look at Aboriginal health status in the Northern Territory, what's happening. I wanted to talk about primary health care and the political economy of health, and then some key social determinants in the NT, access to primary health care, early childhood, alcohol and petrol sniffing, obesity, diabetes and the political economy of food, and inequality. And as I said, some of it, depending on time, I'll skip through some of it and see how we go. But looking at, first thing to say about Aboriginal health status in the Northern Territory, it's improving, and it's improving quite quickly. In fact, the Northern Territory is the only jurisdiction on track to close the gap by 2030. Now, having said that, the overall age standardised death rate is still around 1,400 deaths per 100,000, which is still the highest absolute rate in Australia. But the rate of change here, we're the only jurisdiction that's improving at this rate. The only other jurisdiction that's showing some improvement is Queensland, and the others are staying the same. The major, I'll talk in more detail when I talk about access to primary healthcare. The major thing that's brought that improvement around is the improved health system. So there's been debates within the social determinants, what's important, what's the most important. Certainly we argued that if we got the health system right, we could close the gap by as much as 50%. And basically over that period from 2000 to now, we have really improved the health system. I'll talk about that in more detail. In that time period, nothing much changed in terms of educational attainment, nothing much changed in terms of early childhood outcomes, employment, income. Those things stayed constant, but the health system improved dramatically. And in the latter years, in 2007, from 2007 on, we've had a significant decline in per capita alcohol consumption. And also from 2007, we had the introduction of Opal Unleaded. And Opal Unleaded has removed 8 premature deaths a year just in Central Australia alone. So there were previously 8 young people a year dying from petrol sniffing. Since Opal came in 2007, so in 6 years there's been 1 death. And so it has had a really dramatic impact, and that represents 46 less deaths a year, which Opal's contributed to that in the latter years. But I'll come back to that again when we talk about access to primary health care. In terms of life expectancy at birth, there was a time when we used to say the gap was 17 years across the country. That was only ever based on data from 3 jurisdictions. So it was never based on data from New South Wales, Victoria, Tasmania, the ACT. They didn't have any data, and they're still only just getting data now. But now it's done differently. We know that there's big differences across the country. The national gap is around 11 years. The Territory is still around 17. But, you know, it ranges from New South Wales and Queensland being a lot better. The thing about the Territory is, if you go back 40 years, Aboriginal men in the Territory lived to be 52 and Aboriginal women lived to be 54. So women are now living to be 70 and men are now living to be 61. So even on that basis, there's significant improvements happening over time in life expectancy, although the gap, which is closing for women, is only just started to close for men. The major reason for the gap, 80% of the gap, is midlife death due to chronic disease. So what's happened again over 40 years, you go back 40 years, infant mortality rates were 120 deaths per 1,000 live births, now they're 14, so there's been a 10-fold improvement in that. So there's been a change. It's not babies dying and young people, it's midlife deaths due to chronic disease that are the major contributor to that gap, and much of that's preventable. And there you see the major cause of death, circulatory disease, cancer's becoming more and more important, external causes of injuries, and then diabetes and respiratory illnesses. As I said, under 5 and infant mortality rates have really been improving quite rapidly, and in fact this target is on track to, the target in the COAG, closing the gap targets, was to close the infant mortality gap by 50% by 2018. Well, the country's ahead of target on that particular indicator.